Uh, Good morning, ladies and gentlemen, and welcome to part 2 of our discussion today. My name is Mr.Selfcare, Richard Chimboa, and I'm going to be your host today. We are going to talk about a very important women's health topic, and that is uterine fibroids. We are going to look at management, treatment, and public health impact. Definitely, uterine fibroids affect millions of women worldwide, yet many remain unaware of their symptoms, risk factors, and the treatment option. Our goal today is simple. We are going to shed light on this silent condition, break stigma, and promote awareness through this expert interview that we are going to have. And today we are honored to have with us Dr. Faith Nabushawo, a gynecologist who is a resident from Kampala International Hospital, who is going to discuss with us thorough clinical aspect of fibroid and their impact on women's health. Earlier on, we also had imaging experts that took us through the imaging side of fibroids, how we see them, ultrasound versus MRI, and I believe you have enjoyed that part as well. So if you hear and you missed that earlier discussion, immediately after this, go back and watch that episode. And as the saying goes, when we know better, we do better. This discussion is about empowering communities with knowledge so that women can access timely care and live a happier and healthier life. Dr. Faith, you're welcome.
Glad to be here today to discuss this very important topic. I hope that everyone listening in today will learn a thing or two. Like he has already mentioned, I'm Dr. Faith Nabushawo, a second-year resident pursuing my master's degree in obstetrics and gynecology. And I'm glad to discuss fibroids with you today.
Dr. Faith, I'm glad to have you here. Me and you have known each other for quite a long period of time, all the way from Mulago. At Casualty, Dr. Faith used to be one of those kind, happy intern students. You know, intern students are never happy for some reason, but that smile always, gave us confidence that maybe things are fine. Again, thanks for appearing in newspapers today. I always read Uganda dailies, and so I again saw that beautiful smile in the monitor. Thank you so much for making it the headlines. Dr. Faith, let's start here. What are uterine fibroids and why do they occur?
Okay, thank you for that question. Uterine fibroids, also known as leiomyomas, are benign tumors that grow within the layers of the uterus. By benign, I mean they are non-cancerous abnormal growths, but they are non-cancerous. They are not a cancer. Okay, so uterine fibroids are non-cancerous tumors that grow within the uterus. And these fibroids actually affect thousands, millions of women, like he mentioned. And statistics show that by the age of menopause, that is by the age of 50, 51, like we all know, the average age of menopause is 51 years. So by that age, by the age of 51 or 50 years, fibroids affect 80% of women. That's quite big. That means out of 10 people, you would expect that by the age, out of 10 women, by the age of 50, 8 of them have fibroids. Okay? So this is a serious public health issue and a very big issue when it comes to women's health. These fibroids vary in size, in number, and even in location within the uterine cavity. And by this, it makes them have different or variations in their presentations or severity. He asked me to answer the question why these fibroids no,
Yeah, because,
why these fibroids occur. Now, the exact cause is unknown. Okay, the exact cause is known. However, we know a number of factors that contribute to the development of these fibroids, call them the risk factors. And the number one risk factor being hormonal influences. We see that fibroids are a hormone dependent disorder. So hormonal influences play a big role in this, and the major hormones in these fibroids being the what? The estrogen and progesterone that stimulate fibroid growth. And some of the risk factors that have been identified are things like, conditions that make a woman get predisposed to high levels of these hormones, like the estrogen, for example. And this happen in situations like where a woman hasn't given birth. Okay, so not giving birth itself is a risk factor because a woman who has not given birth is exposed to high levels of unopposed estrogen. Okay, so now this increases the risk of of getting the what? The fibroids, things like not giving birth or low parity, having like one child or two children. So those are some of the identified risk factors. The other big risk factor here is age. We see that these tumors are common among women of the reproductive age. That is from, but the peak is between 25 and 30 years, okay? But women in the reproductive age are at risk of developing these uterine fibroids. The other risk factor that has been identified is genetics. We've seen that if there is a family history in your family, if there is a family history, let's say maybe your mother, your first degree relatives had fibroids, your chances of getting them are 2.5 higher than the other people who don't have a family history of that. So genetics also play a role in this. So we see that they tend to run in families. When there is a family history of fibroids, find that you are also at a higher risk of getting them. Some genetic mutations have been identified also in women with fibroids. So we believe that some genetic disorders or mutations also increase the risk of getting these fibroids. And also environmental factors and other factors such as obesity, lifestyle, diet, and all those. So those are some of the identifiable risk factors and things that could predispose or increase one's chances of getting these fibroids.
okay. You
Thank you.
know,
Over to you, Richard.
thank you so much for that, because there has been a lot of debate. Recently, I saw one of your fellow doctors coming on X saying, oh, you don't want to give birth, but soon you're going to have a lot of fibroids. And there was a backlash. Women saying, oh, it's not about giving birth. There are so many other factors. But I think you brought it out well, that there is no one given cause that can be responsible for all, but some factors are more responsible than others. What are common signs and symptoms that women normally experience when they have these fibroids?
Um, They are, like I already mentioned, that from the introduction, that these fibroids can vary in size, number, and even location within the uterus, and that makes them present with different signs and symptoms. In some women, they might be asymptomatic. I mean, they don't have any sign, they don't have any symptoms. Okay. For example, if they are, maybe the fibroids are very small, some women will have the fibroids and they are asymptomatic, they don't have any symptoms. But the commonest symptoms among those that present with them is heavy menstrual bleeding. Okay. Most women with fibroids present with heavy menstrual bleeding, which is sometimes prolonged or excessive bleeding during the menses. You know, women, we know that every month you go into your menses, and there is that amount of blood loss that you experience. Maybe you change a pad 2 to 3 times a day. But when you find you get a point whereby you notice a change, initially your periods have been occurring, maybe 4 to 5 days, 3 to 5 days, you're done. And then the flow, you can tell that, oh, this is the normal flow that I'm usually have getting. But when you notice that there is a progressive increase in the what in the menstrual bleeding, that should ring bells and cause you to think what could this be fibroid. But I mean, heavy menstrual bleeding could be due to other very many different causes. But for women with fibroids, the commonest symptom is heavy menstrual bleeding or prolonged bleeding. And most times this bleeding can also be painful menstruation. You know, we know we expect that sometimes during menses there are cramps. Women may experience those mild cramping and all that, but women with fibroids tend to report painful, excessive bleeding. Now, the other commonest presentation is pelvic pain. Okay, so these women sometimes present with pelvic pain. Sometimes it can give them what we call chronic pelvic pain, pain that is just not going, it's just there, causing discomfort, cramping, or sometimes they even when the fibroid is big, it can create pressure symptoms. A woman complains of things like, I feel like my pelvis is full, is heavy. You know, those are now the pressure symptoms, depending on the size of the of the fibroids. The others, they can present with history with things like frequent urination. We see that large fibroids, if the fibroid is so big, it can press on the bladder because the uterus is down there and then the blood is just on top of it. So if the fibroid is so big, it can press on the bladder, and then the woman will always feel like it will compromise the bladder space. So the woman will feel so full faster, and they will keep urinating and urinating. So they will frequently urinate because of the large fibroids pressing on the on the bladder. In some cases, when the bladder, let's say, sits on the bowels, I mean on the guts, women can present with even constipation because they have these big fibroids have rested on the gut, and then they are occluding the
The bowel.
the outlet. Yes, yes. So and that causes them things like constipation, but that is in very, very large fibroid. Like I already said, that this fibroids vary in size, shape, and even location. And also it depends on where this fibroid is located in the in the pelvis. The other presentation is infertility. We are going to discuss how fibroids affect infertility, but some women can actually just present with, they might have all these things, maybe experience heavy menstrual bleeding, and then the woman thinks, oh, maybe it's just normal, maybe that's just how I am. Until later, when they present with infertility, they've been trying to conceive and then they can't. And that's when they realize, oh, they actually have what? Fibroids. So women with fibroids can also present with infertility. I've been trying to conceive, but I can't, because we know, as we're going to see from the discussion as we continue, see that fibroids actually also actually affect fertility, and it can cause infertility in some women. Like I already mentioned, all these presentations depend on the on the size and then the location of the of these fibroids. So we are going to see that fibroids also interfere with fertility, they interfere with implantation and cause a lot of pregnancy complications, that we are going to see. And then the other presentation could be abnormal, what we call the abnormal uterine bleeding, okay? We know that there is that monthly uterine bleeding that happens as in a form of menstruation. Okay, so that is normal. Okay, every month we see that women in the reproductive age, they get monthly period. But a woman with fibroids, like depending on the on the location of the fibroid, maybe it is a fibroid polyp, these women can sometimes present with abnormal uterine bleeding. That is bleeding that is not related to your cycle. Maybe you just had your period today and then you finished maybe in 4 days. Then after like 6 days again, you experience another bleeding. So some women will present like that, like man tells you, I have irregular bleeding, unscheduled, unpredictable bleeding. I thought I just finished my period, but again, I saw bleeding. Yes, yeah. So those are just some of the symptoms that women could present with to us at the hospital. Thank you.
Oh, thank you so much, Dr. Faith, for that elaboration. You see, uh, one of the things surrounding women health is a lot of misinformation. That women are picking information from all kinds of sources. Some people think fibroid is witchcraft. That is somewhere where I went and were casting demons out of a woman's uterus to chase away these fibroids. And earlier on, one of the discussants I had, a sonographer, said that when she was still in Uganda, people used to go and sometimes if she told women they had fibroid, they would say, "Oh, someone bewitched me that fibroid." So really, this information is very important, and I'm happy it is coming from someone that is skilled in that area. Let's talk about uh, the impact, because when we talk about anything in the uterus, you say these are uterine masses, and what is the impact of fibroids on fertility, and how dangerous can it be?
Thank you for that question. Okay, thank you. Fibroids can actually impact fertility and even pregnancy outcome in very many ways. First, fibroids themselves, they can cause infertility. Okay, how? Like I already mentioned that these fibroids vary in size and even location and even so when you find that a fibroid is located at the cornea, at the corneum, that is the yes. I wish I had something like that. So some fibroids, depending on their location, they could cause occlusion of the what? Of the tube. The
Yes,
tube has to be patent for the egg to
yes,
move from the ovary after fertilization, and then it moves through that tube to the ampulla where fertilization takes place. And then the
yes,
sperm actually meets the tube, the egg at the ampulla where fertilization takes
yes,
place. Now, if you
yes.
have a fibroid occluding, okay, it will stop the sperm ascent to meet the egg for fertilization to occur, and that can cause infertility. Okay. Now, in some cases where, let's say, implant fertilization has occurred, these fibroids, if they are located, for example, in the uterine cavity, okay, they can distort the uterine cavity and impede implantation from occurring. And if implantation cannot occur, a pregnancy cannot happen. You get.
Yes,
So they can
yes.
also cause implantation issues by distorting the uterine cavity and making it hard for the embryos to implant. Okay. The other also further, I said it's already a hormonal issue, and the hormones that we need in ovulation are the very hormones that play a role in fertilization. So they can also interfere with ovulation itself. And if ovulation has not happened, fertilization becomes, pregnancy becomes very hard. Also, these uterine fibroids, I already mentioned that they can interfere with implantation, not only just implantation, they can also interfere with placentation and all that, and lead to adverse pregnancy outcomes, such as miscarriages, preterm labors, fetal growth restrictions, the abruptions, and all that. So, away from just affecting fertility, they can also cause pregnancy complications, such as miscarriages, because the baby is trying to grow, but then the uterus is taken up by these masses, by these tumors, and then the baby is some big fibers can even just impede the take up space, and then the baby can't just grow, and then things like miscarriages and all that. Even at delivery, fibroids can also cause delivery complications. And for example, large fibroids can obstruct the birth canal, and this increases the risk of cesarean deliveries. So, summary of this, we have to know that fibroids are responsible for 3% of all cases of infertility. I mean, all
Wow.
cases of infertility, fibroids are responsible for 3% of them. I mean, there are other causes of infertility, but fibroids also, depending on their location, they can cause infertility.
Wow.
Thank you. Over to you.
Th- Thank you so much. And again, if you're there and you have a question, I believe I'm having one of my best panelists on this channel, very eloquent and confident in what she's saying. Again, thank you so much, Faith, for accepting to be here with us to teach Ugandans about this, because when we pass on this information, we somehow save a life, because if we don't give them the right information, the border guys will give them this information in the way they understand it. Can you imagine? So Faith, away from that, what are some of the myths and misconceptions that you've heard about fibroids in the patients that you've worked on? What do your patients normally tell you about these fibroids? The misconception or myth that you've come across?
Uh, okay. The commonest that I've come across is that women thinking or believing that fibroids are some sort of a curse that has
Mm-hmm.
been brought on them. So you find them opting for prayers and all that. So sometimes when they are bleeding so much, and then they are having things like anemia, they believe they keep, because they keep having heavy menstrual bleeding. I've had scenarios where a man comes to me, has been having heavy menstrual bleeding, causes them anemia, they are transfused. Again, they go back home after 2-3 months. Again, they have been having heavy menstrual bleeding. They come back again, they transfuse them, and then they feel like, oh, maybe this is just a curse. There is something that is has been placed, or a curse that has been placed on me to suck my blood out. That's why I keep getting transfused. So it is not witchcraft. It's not what it's known condition in medicine, and there are treatment options available for it. Okay, so
Okay.
we will discuss the treatment options. The other means misconception I've come across when it comes to these fibroids is that people thinking that they are cancer. Cancer is
Yes.
the word that people will quickly just grab and use in the
Yes.
corridors, women telling themselves, oh, this is a cancer, this is a cancer, this is a cancer. Now, once they come to you with that belief, they come already in distress. No one wants to hear that I have cancer or I got cancer. You get.
Yes.
So they come already in distress. Already this condition itself can impact one's mental health. Okay. Imagine having chronic pelvic pain. Imagine having a mass that you touch on your abdomen and you feel there is a mass there, and you don't have any information. It already it's enough to cause you mental distress. Okay. Actually, I'm interested myself in a study to do with mental health and these tumors. And
Yes.
yes, so already I know that we know that it can cause already the mental distress. Now, adding on a belief that it's a cancer, it makes things worse. So you find that women are coming into the consultation room already distressed. They've been told this is a cancer, there is no cure, you're going to die, and all that and all that. So already it is just too much on their mental health. So I want to make it clear that fibroids are not cancer. Okay, they are not a cancer. They are benign tumors. and the treatment options available. These we're going to discuss, I believe. And then let's note, I want women out there to know that there is help, okay? They can be helped depending on their desires and on their presentation and all that. So it is not a cancer. They are non-cancerous tumors of the what? Of the uterus,
Uterus.
and there are different treatment options available for these women. Thank you.
Okay. There is always there is okay, let me do this and do this. Okay. So there is always a misconception, especially my colleagues who do imaging. Now let me ask the expert. Are all masses in the uterine walls fibroids? And on sonographic evidence, are all of them solid, or we have some of them can eventually turn into cystic?
Okay. Not all masses in the uterus are fibroids. Okay.
Okay.
Some of them can be polyps. Okay.
Yes.
These are just abnormal extensions from the normal outlining of an organ. So it can
Yes.
be a polyp. There can be polyps, and some growths can actually be cancers. Okay.
Okay.
One of the complications that I should mention, although it's very rare, is
Yes.
that these fibroids in the long run, some fibroids can turn into cancer. Although this is
Okay.
it's one of the complications of there are different complications or changes that occur in a fibroid. Some of them shrink and then disappear, and then others do what can turn into cancer. Okay, so although the malignant transformation is a rare one, but it can happen and cause what we call the leiomyosarcoma. Okay, which is now a cancer. Yes, but
Okay.
not all growths in the uterus are fibroids.
A
Thank
very good message from the head of reproductive health in Ministry of Health, saying thank you so much, Faith, for representing us well. That is someone at the Ministry for Reproduction. Yeah, I know they always watching. Faith, again on that. Let's talk about early treatment. We've talked about a diagnosis area with colleagues from the radiology. What do you normally do as doctors when you see these symptoms? We send people for imaging. They go do the scan, trans-abdominal or transvaginal. We've had enough discussion on that. Now, my question here is, how important is early diagnosis for these women? Because in Uganda, we still have a challenge of people reporting so late with diseases. When it comes to fibroids, does early diagnosis really help in you people that are going to manage this condition?
Yes, sure. Early diagnosis is important, let's say, in any condition that you would ever think about. Okay? Catching a condition or a disease early not only improves the treatment outcomes, but also, I mean, also the general well-being, the health of the what of the patient, and even the what yes, and everything that's about the patient's well-being. So early diagnosis in any condition, I would say yes, it's very important that our people actually improve healthy seeking behavior and then seek out for help before complications come in. Now, when we talk of things like complications, it means that a condition was there and now it has just advanced to now become a complicated one. So early diagnosis is very important. One, it will prevent the complications. You catch the disease early and start your interventions early before it becomes a problem. You get. But when these women come to us for treatment, the treatment options are very many, and they
Okay. We are privileged to be here with Dr. Faith today. She's, I think, disturbed by the internet, but she should be back in. Again, earlier on we had a discussion with imaging specialist on diagnosis, on the different scans that are done. And now we are having a gynecologist to actually take us through. And it's very interesting. So if you have a question, please put it in the comment section and you're going to be responded to. Do not miss this opportunity to have free consultation with a specialist. Yes, Dr. Faith, we were talking about
Yeah.
early diagnosis.
Okay. Sorry, I just got a network glitch here.
It's okay.
But I already mentioned that early diagnosis is very important for every condition. Okay. It's just very good that condition is caught early before we start going into complications and then other, or even and have a better outcome, okay, or
Oh,
of
yes.
treatment. So the other question that you asked was about the treatment options and how do we manage these women when they present to us with fibroids. I already mentioned that different women present differently and they present with different signs, symptoms, and all that. So treatment depends on the presentation. Okay. Some of these women present with heavy menstrual bleeding. Okay. If it is heavy menstrual bleeding, we are going to respond to that by reduce the bleeding. Okay. And also even some drugs that are hormones. Okay. That help reduce the fibroid sizes. Okay. And when you reduce that, also you're going to the uterine, the fibroid side, you also reduce the what? The symptoms. So if the problem is heavy menstrual bleeding, we are going to handle that. There are different drugs that we can use to reduce on the bleeding so that we don't go into anemia. But if the woman has so bled that they are already anemic, we also now add in the what? The blood transfusion or add in hematinics to boost the blood levels and all that. And also, if they present with pelvic pain, we are going to control the pain. Okay, we're going to control the pain. And also, if they present with pressure symptoms, let's say the fibroid is so big it's causing them constipation, and before we know they are getting, we don't know way to get into that. Then maybe that's when we'll be like, okay, I think these fibroids, we need to remove them. So summary of this is that there are medical management modalities and also surgical management modalities, but all these will depend on your gynecologist. I mean, the doctor attending to you will review you, will assess the need, your condition, severity, factoring in complications and all that, and then will determine the best treatment option for you at that particular moment. So there is just not one treatment option. I cannot say every woman with fibroids will do A, B, C, D, Z. You get? Because different women present differently with different complications, different presentations, and all that, and even different symptoms. But depending on the symptom or the presentation, we manage that. Also our management still also goes down to the woman's fertility desires. We know that in the surgical management, we have the surgical management options, and they are different also. Okay, there can be minimally invasive procedures such as laparoscopic or robotic surgeries. You get. Then we also have uterine embolization, where we cut off blood supply to the what? To the fibroids, okay? And then there can be myomectomy, which is the most commonly done, okay? So if a woman presents, and then also you have to factor in their fertility desires. A woman presents to you, they have these fibroids. The fibroids are giving them issues. They are bleeding so much. They are presenting with symptoms. But then when you ask her, she has fertility desire. She said, doctor, I would love to have another child or children. So you're not going to choose removing the uterus as a treatment option. I mean, it is a treatment option. You just remove the uterus, okay? But in such a woman, you've talked to her and you see that she really needs a child, and she tells you, Dr. Me, I need a child. So you as a doctor attending to her, you need to now, after investigating all other causes of infertility and all that, you can now give her a chance and then just do a myomectomy where you just go in and remove the fibroids and leave her uterus there. And actually, removal of fibroids, some fibroids like the submucosal fibroids, their removal actually have shown to improve fertility. Okay, in women who had infertility, when you remove these fibroids, the submucosal ones, you find that their chances of fertility, they go home and then they come back and like, oh, I conceived after the what? The fibroids were removed. So the treatment option, they have to be tailored to the patient, their desires, their future aspirations, and all that. So we look at a patient as an individual. We do not generalize and be like, okay, for fibroid management, we do A, B, C, D, Z, and then that is it. No, there is no such a thing. So the treatment is tailored to the what? To the patient. We can just choose to remove just the fibroids and leave the uterus. Or in some cases, you can be like, okay, let's just go and remove the what? The uterus as a whole, depending on the what? On the prevailing circumstances. Well, there are specific indications for these different treatment modalities.
Yes.
Thank you.
Wow. This brings me to two questions. Number one, when I used to practice my sonography in Uganda, there is something that I always had issues with. Women coming in and say, oh, I had fibroid, then I went and they gave me herbals, then they told me that those masses are going to come out and drop out. Have you come across such accusations or statements?
Yeah, I've heard of all that, where women believe, oh, I took this herb and then I mean, I don't want to discuss much of that, but I mean, when you're selling your thing, you have to give it the best PR that you got, So I've seen things like this drug, this herb is going to remove hernia, all these are the things that we've had in the corridors and they are actually happening. And it breaks my heart that some of these guys are advertising these things openly. I mean, they are even
Yes.
just so free to advertise some of these things, and I feel that that is doing so much harm. And now that's why I was very happy to join you to discuss this today, so that to counteract the wrong information out there by giving the people
Yes.
now the right information. So the treatment of fibroids is their removal, surgical removal. You have to go and remove the fibroids. Not that I will take this fluid and then liquid and then the fibroids will remove them. I haven't come of
Actually,
such data
let,
confirming that.
let me reiterate this and confirm. To everyone listening in, I've had a chance to practice in 4 countries. That is South Africa, UK, and US now. Up to now, banange sinawulirako nti ne lyeddagala libawa omuntu ebizimbe ne bivaamu. I've not heard that there is a medicine which they give a woman and those things drop out, like the herbalists tend to cheat women on. To every lady listening in right now, you're listening in from a gynecologist. I've not just picked someone to come and discuss. Normally when it's women health, I always want to speak with specialists because there is a lot of lies. There is a lot of misinformation. Women are cheated. Some of you have not gotten children, not because you can't get, but because you're seeking guidance and treatment from wrong people. Not everyone is qualified to treat women reproductive issues. They are only gynecologist and obstetrician, or if that's what they call them. Not sonographers, not clinical officers, not any other doctor. They are specialists that handle that. Now, until you meet the right people, you're delaying your time of actually having that precious baby that you want to have. And the beautiful thing is that in all district, now our district hospitals or regional hospitals, government has put at least one or two gynecologists to handle those cases. Yes, the lines may be longer. Yes, you may have to wait longer. But it's better you wait long and you get treatment from a rightful person, other than taking jerry cans of herbals that are actually going to injure your liver. Before you know it, you're not getting the child and the liver is also damaged. Uh, the other question, I think you answered it, but I just want to come out clearly. Is it a must that all fibroids are supposed to be operated, or it depends on what the patient wants and also other factors like size and location?
Okay, I just mentioned this, but I'll say it again because now that is what most of our listeners actually want to hear. Now,
Yes.
the fibroids, the removal, and also the medical management depend on the what? On the symptoms and severity.
Mm. Again, if you've just joined us, we are so honored this morning to have Dr. Faith Nabshao, all the way from KIU Hospital, discuss with us very important topic. A lot of women out there have not had a chance of having a baby simply because of fibroids. Many of you have sold your cows, your goats. Many of you have spent a lot of money in hospitals. And I'm happy that she's here to clear lots of lies and misinformation. For example, she has clearly said that not all fibroids are operatable. The reason they operate on fibroids is depending on the woman's desire to have more children, the location of the fibroids, the size, and also other things. She has also clearly put it that there is no medicine known to her to cure the fibroid themselves. There could be some medicines to reduce on the signs or the symptom. For example, if a lady has, due to fibroid, there are hormonal issues, they can give you medicine to balance that up. But she has clearly said up to now there is no medicine to cure them. I know so many people that have been cheated with herbal medicine. And again, so we are glad that we are having that discussion today. If you have a question, please put it in the comment section. We are here to clear stigma, to clear misinformation, and to make sure from today onwards, you're not cheated anymore. Yes, Dr. Faith, we are happy to have you back.
Thank you. I was saying, I was answering to your question, are all
Yes.
fibroids supposed to be removed surgically? The
Mm,
answer is no. Okay?
okay.
Like I
Mm,
already mentioned, that some fibroids, some women will have fibroids, but they are asymptomatic. They're not causing them any problem. You sometimes you find you do a scan for other things, and then you
mm,
incidentally find a fibroid there. But you find they're not giving this woman
mm,
any issues. So why do you just go and subject her to all the other complications of the surgery and all that, when I mean they are there but they are not causing her any issues, you get?
mm,
So not all of them should be removed, but there are indications for removal. Actually,
mm,
the fibroids that we want to look at are those that we call the symptomatic fibroids. Okay.
mm,
The woman keeps bleeding, getting anemia, has been transfused 5 times in a year just because of the fibroids. Why don't you go in
mm,
there and do the surgery? Okay. So it is
mm,
symptomatic, it's a complicated fibroid. Maybe a fibroid has been infected. You want to go in and
mm,
remove it because you're not going to leave the infection in there. Okay. The
mm.
fibroid has twisted in the cases of like pedunculated fibroids. I mean, those are
Yes.
things that you want to look at and be like, okay, I think we need to go in and remove them, but not all of them are necessarily require surgery. Okay.
Mm,
Sometimes medical management can help reduce these fibroids sizes, and then improve symptoms, and then so like the management has to be just tailored per patient. Okay, your doctor after your assessment will decide together with you, okay, what is the best. We'll give you the information, and then together you and your doctor, you can decide what is the treatment modality to take on, but not all of them should necessarily subject one to surgery.
Okay. Doctor, what have we done to reduce stigma for women with fibroids? Because some women have been left behind by husbands. How can we reduce stigma and some cause reassurances among your patients that have fibroids being diagnosed?
Thank you. One of the things that we can do to reduce stigma is one, increase awareness through the health talks, through one of the things that we are doing like right now, giving the
Yes.
information, the right information to the people. So when we increase awareness through the health education talks, educating women and all the communities out there about the fibroids, their symptoms, their diagnosis, and treatment options, letting them know that there are treatment options available for them in one way or the other will reduce stigma. Because I mean, imagine having a condition and then someone tells you, look here, there is help out there. There is actually help. You can be helped. There is treatment for you. It can reduce your anxieties and then, reduce the stigma also associated. When we increase awareness, you give the masses, the communities, the right information. Tell them that these are not curses or anything. They will learn to embrace each other, and instead of judging, thinking, oh, this one maybe did this, I know he did a god disease, so he has gotten a curse and all that. So I believe by increasing awareness, there is so much that can be done to help. The other is increasing access to care. Okay. Increasing
Yes.
awareness is one thing, but also increasing access to care, ensuring that women have access to gynecological care. I'm glad that the government here in Uganda has is employing actually gynecologists, even in the lowest facilities down there, to have one or two to attend to these the mothers. So increasing access to care, improving health care itself, especially in the underserved communities, can really help improve the fibroids. Also, the other thing that could be ignored is creating support networks. You get creating like women groups living with fibroids, to spread this information. When someone you're talking to someone who actually has suffered a condition or has a condition. Imagine a woman who had maybe a fibroid, she had infertility because of the fibroid, it was removed or she was treated and then she got pregnant. Now imagine if these women come together and then they form support groups that provide resources and support to women also living with fibroids. It could really, really help so much in doing away with the what? With a stigma and the things that come with it. You get. So support networks are very, very important, and also healthcare provider training. Training, like people who are going to be managing or handling or training. Treating our mothers, the women also. Is one way of what of increasing not only access, okay, to healthcare, proper healthcare, but also it can one way or the other reduce the stigma and its impacts when it comes to support to these women, and also research and development, investing in investigating things like the new treatments available and understanding the causes and improving the existing therapies among the scientists. This can also help come up with new modalities on how to handle or manage these conditions. Over to you. Thank you.
Again, as we wrap up our presentation of the day, I know you're very busy and you're handling a busy facility over there. How can healthcare systems strengthen early screening and treatment services? How can we ensure that? Yes, Faith. How can we ensure early screening and strengthening how can we ensure
We
early
can
treatment
ensure
and
that by improving access, okay, to healthy, to yes.
okay. So again, I'm one advocate of public health. And every Sunday, every Thursday, I'm always here talking about disease and disease and disease.
One,
So what's
through public health awareness talks, okay, go into the villages and inform the mothers of the symptoms and then encourage them to go to
again, if you're here with us, thank you so much for honoring our invitation. We are having Dr. Faith Nabshaw, all the way from Kampala International University, and we are discussing fibroids. Earlier on, before she came in, we had a discussion with imaging experts on the same. If you missed that earlier discussion after this, please go back and watch that. Why do we labor to invite or to have these people come speak to us? The reason is very simple. We want to create awareness. Let me tell you, so many women out there crying. So many women out there have sold all their goats, have sold all their cows because of that. Yes, Dr. Faith, I was asking, how can we create how okay. I was asking, what role does public health education help in addressing fibroids? How can we?
public health
Yes, yes,
awareness. One, it will
yes,
increase knowledge. Yes. And
yes.
once the people have the right knowledge of the disease, the signs and symptoms, and
Mm,
then the places they can go seek help, I believe
mm,
that this can improve the what? The our health seeking behaviors,
mm,
and I've seen this thing actually work. Okay.
mm,
Some women come and they'll be like, okay, they are this how they came to the village and then they told us about this was a cervical cancer. They told us about cervical cancer, and then they told us this and this and this. That if you have the following signs, please go and present, go and screen. And then that week we received so many coming in for what? For these screenings. You get this just
mm,
followed the what? A public health awareness in that particular community. And the
mm,
following week, we received so many. I mean, that was the feedback that we got. We received so many at the health facility coming in and like, oh, we were told, or we even heard over the radio, okay? So increasing public health awareness through all the platforms available. It can be
mm,
social media, it can be over the radio stations, or going to
mm,
the communities, sending people in the field to the communities to educate these women or communities about these fibroids can improve one, the screening services. Imagine you come and
mm,
tell me, okay, if you have this, please go and screen. We are screening at this hospital. I mean, you even tell me where to go for screening. I might be even having the symptoms, but I know nothing about what to do about it. So I just stay there with my
mm,
symptom. You get. But if you tell me that, oh, when you have this, it could mean that you have a fibroid. Please go to this place and then screen. It will help me do what? Go and screen. So public health awareness itself, one will actually, it's a primary prevention. It helps in primary prevention before
mm,
the women even get the disease. So come and tell them, and then they come screen, and they, screening
mm,
test doesn't mean that you have a condition, but it just means if you have this, go and screen. You never know, you could have or you could not have. So if you find
mm.
you screen and you don't have the condition, then you can be given still proper advice on how to prevent it moving forward. So public health awareness plays a very major role in early diagnosis and improving screening services and our health seeking behaviors.
Yes, and
Thank you.
second last doctor here is What are some of the complications of fibroids that are not treated in time or that are not managed?
One of the complications is the commons. Yes. So one of the complications that they could get is anemia. Okay. When the I already mentioned that the commonest presentation is heavy menstrual bleeding, prolonged heavy menstrual bleeding, and all that. And some of these women present with anemia and a sequel of events. Anemia itself can also lead into heart failure and all that. So anemia is one of the complications, and if it's not managed still, it can also now lead to what? Things like heart failures and all that. So anemia is a complication. Also chronic pelvic pain, okay? When these fibroids are not removed, pressure symptoms, they are just there. So they can present with chronic pelvic pain. The other complication that I cannot go without mentioning is infertility. You see that fibroids are responsible for 3% of the cases or causes of infertility. So infertility is a very serious complications. And because of these, also some studies are showing that because of these presentations, okay, the diagnosis itself, first of all, it's a chronic condition, okay, and then it's causing this heavy menstrual bleeding, prolonged, and then you have irregular menses, you have pelvic pain, the pressure symptoms when they come in, things like the constipation that I mentioned, even
The
sometimes if they
constipation.
press on the ureters, depending on the location of them, yes, they can cause urinary outflow complications and all that. So, if they are not managed very on time, they could cause actually these presentations themselves, the signs and the symptoms also could actually cause mental distress among women, things like depression, anxieties, and all that. So those are some of the long-term complications of these fibroids. Also, the other complication which I said that which is rare but can occur is these fibroids transforming and changing and becoming cancer. We know that they are not cancer tumors, but some rare cases they can become leiomyosarcomas, which is a cancer. You get, so those are the complications of the fibroid. Others, the fibroid can also get infected, and now you have a superimposed infection on the fibroid and all that. So those are just some of the complications.
Um,
Thank you.
and lastly, what advice would you give to women who fear coming forward due to stigma and cultural beliefs?
The advice that I have for women out there is that I want them to first of all understand that they didn't have any role in the cause of the fibroids. I've seen young people. You know, when you look at the risk factors, I've seen also young women as early as 24, they have fibroids. You get. So I want women to know that it is not their fault that they have fibroids. They didn't do anything reckless to get the fibroids. So after knowing that, I want to know to have women avoid that self-blame game, and then they be there thinking, oh, maybe I had a role in the development of these fibroids. No, you didn't have any role in the development of these fibroids. We see such risk factors as genetic mutations. I mean, you had nothing to determine your genetics and all that. So it's the self-blame and then self-pity should stop, and then also understand that there is help out there. There are different treatment modalities that you could have. They are treatable. I mean, fibroids are treatable, They are not a life sentence that, oh, when you have fibroids, that is it for you. The next thing, just wait for the grave. No, they are treatable tumors, and there are so many different treatment modalities. even if you're going to go surgical, there are those minimally invasive surgeries, like, I mean, like the, depending on the fibroid dislocation and all that, you can go for a minimally invasive surgery whereby that you don't have to go for any open abdominal surgery. You can just go for that laparoscopic surgery, just a small hole, and then they have the thing removed. So there are so many different treatment modalities, from the medical to the surgical, and even the surgical has also different surgical modalities that can be done. So women should just know that there is treatment, understand the risk factors. There are modifiable risk factors that can be improved. Well, you can do something about it, but most times, my opening statement, I mentioned that the exact cause is unknown. The exact cause of these tumors is unknown. So I don't want women blaming themselves and then holding themselves backward because they are judging themselves, bitter on themselves. That can only just draw you into mental distress and all that. So understand that there is help out there. If you did a scan and then you were told that you had fibroids, or you've been having these symptoms that we've discussed, one thing I would ask you to do is go out there and see a doctor, and then you will discuss the way forward on the journey to healing. Thank you.
Again, Dr. Faith, I want to thank you for your time and for being here. Maybe one of the questions that came in from the viewer is that why is it that some doctors tell us to conceive in case they discover fibroid?
Thank you. Already mentioned that if you found to have fibroids, you know, we know that one of the risk factors of them is not having children. Now, when doctor tells you that, oh, you have a fibroid, and therefore maybe the fibroid is small at that moment, and we know that this fibroid, if you let it grow and then take up so much of the uterus, it can cause you infertility. So if a doctor cancels you and tells you you need to conceive, one, pregnancy is protective against fibroids. So maybe they are just looking in the future. Don't delay, because you already have a fibroid, it is now small, you have a chance to conceive. When you leave it to grow, it can now grow up in the cornea, and then it occludes the tubes and all that. So they're just telling you, look here, we are looking into the future. If you can have a baby now, it's better that you just have a baby right now, because we know that these fibroids can, in the long run, cause infertility. So if you pick it when it's very small and maybe you find that you're already married, I mean, even me, if I were the one, I would tell you, please, if you can, it's better that you conceive at the moment, if you can.
Wow. So, our dear girlfriends and wives, please, let's have children, let's have babies. Let's have babies. Again, thank you so much, Dr. Faith, for your time. Can you give us your closing remarks? And please, next time we invite you, just like today, please always turn up. There are so many issues around PCOS, polycystic ovarian diseases. There are so many issues. Someone asked me a question that I didn't want to ask you today, because today I say, why are we having so many cesarean section today? That I think will be a discussion of its own. So I know you're very busy, but once in a while, at your own timing, we can always set up special sessions for you in your own time, whenever you're available. What are your closing remarks before I let you go?
Before I give my closing remarks, you just mentioned something telling women, oh, please go out there and start having children. No, my ladies, please plan. Have children only when you're ready, okay? Have children only when you're ready. Don't let anything put you on pressure, okay? So be ready before you can have children. Okay, discuss with your doctor and then see how to go about that. So my closing remarks, one, I would like to remind us that fibroids are non-cancerous growths in the uterus. They are not a cancer and they are not a life sentence. If you have the fibroids, it doesn't mean that the next thing just have to wait for your grave. No, there is treatment. They are treatable tumors, and there are different treatment modalities out there. So stop beating yourself up and then, seek treatment talk to your doctor, and then you will come up with a management plan that is best for you, depending on your doctor's evaluation and your the prevailing circumstances. So there is help out there, and don't let anyone feed you the wrong information. Okay, in this era, actually, you can find information everywhere. In this era, just get your phone, try to read about something. You can even go and find research papers. I mean, there is information everywhere. Okay, so don't let anyone lie to you. If you're in doubt, speak to your doctor and get the right information. Learn to always get the right information, because information is out there, but from who are you getting the information? So get the right information, get yourself the right information, arm yourself with that, and then be ready to face it. That is it from me. And lastly, I want to say, Richard, I'm very honored to have been part of this session, and I'll be glad to talk to the people again. So feel free to invite me. I would really, really love that. And one of my goals is to actually increase awareness, health education when it comes to women's health, because I see a lot of misconception.
Yeah.
I go to TikTok and sometimes I cry. I'm like, what? Someone gets a topic, a very serious topic, and then they are just giving a lot of information. And I listen to a whole clip. I'm like, what? And women are believing, and then they are clapping, and then they are following. I mean, it's so sad. Actually,
They are
one of
giving
my
lots of money.
things is to increase awareness, because I believe in yes. So I believe that health education itself can greatly reduce a lot of complications, and even the funny things that shouldn't be happening. So that is just one of my goals, is to create a platform that can increase awareness. I'm trying to do that through my Twitter. And yeah, anyway, I'm just so happy that you gave me this platform to share about fibroids. Thank you so much.
Wow, what an enlightening discussion that we've had. And on behalf of our audience, I want to thank you, Dr. Faith Naushao, for sharing your knowledge and insights about fibroid. Today, we've not only learned about fibroid in a clinical manner, but we've also understood the public health impact, the importance of early diagnosis, early awareness, and about compassionate care. You've also told us that fibroids are not the end of everything. It's not a death sentence. Discuss both surgical and medical options, and when we can actually apply both. I believe my viewers and audience has learned a lot, and I believe that one woman or those two women that have turned it today have a lot to share with their friends. To everyone that is listening today, please feel free to share this video. We don't charge anyone. It is a free podcast because we want you to get free information. So don't be selfish. Forward the videos and follow Dr. Naushao Faith on X and all those platforms to make sure we spread the good news. To all healthcare professionals, it will be so useless if we die with all the information we have in our heads. Find platforms. It could be your own platform. It could be on X. It could be on Facebook. It could be on TikTok. Whichever platform you can use, let's share out the right information. Because I'm telling you, if we don't, there is a senior for drop up that is going to read about fibroids and is willing to go on TikTok and hold a 3-hour conversation on fibroids. And who gets this information? It's your wife, it's my daughter, or it's my sister. So by the time you find out that your sister is actually going to undergo a surgery they are not supposed to go for, it's going to be too late. So the earlier we move out and occupy these social media platforms with the right information, the better. Nelson Mandela once said, education is the most powerful tool which you can use to change the world. By educating ourselves and our community about fibroids today, we can break barriers of silence, empower women, and save lives. Again, thank you everyone who tuned in and engaged with us. Don't forget to share, subscribe, and comment. And please continue this conversation in your communities. Together, we can create a healthier future for every woman in every part of the world and every day. Have yourself a wonderful day, and may God bless you. Bye.